Hi, thank you for joining us. The truth is that no one likes to talk about cancer. It's at the top of everyone's list of unspoken nightmares. But MedTech companies are making massive leaps forward in the early detection, treatment, and monitoring of patients. On this episode, we'll be speaking with Dr. Nicolas Girard. He's an oncology specialist at France's Institut Curie about an impressive new MedTech application called Moovcare. Moovcare helps doctors and patients with early detection of complications or relapse of lung cancer. I'm Jeremy Ladner, and this is What's New. Dr. Girard, thank you so much for joining us on the show today.
Good morning.
Good morning. So let's start maybe with something that's topical. Obviously, so many people around the world right now are still dealing with coronavirus, COVID-19. Many people are worried about a second wave, what might come next. How does that impact you and your oncology practice and the patients that you need to treat who might be suffering from lung cancer?
Well, we have two challenges. The first one is to ensure that the patient will not have coronavirus, because those patients with lung cancer, they have a higher risk to develop severe infection with complication and need for intensive care unit. So this is the first challenge. And the second one is to continue to treat those patients against cancer. So delivering the treatments and ensuring a close follow-up of those patients who may present with disease recurrence or any kind of complication.
I see. And in terms of Moovcare, I've heard a lot about it lately, and perhaps you can tell us a little bit about how that's helping you help patients managing their symptoms, managing their appointments. How are you utilizing Moovcare? Can you tell us a little bit about it and how it's helping?
Well, Moovcare is a perfect way to collect on a regular basis the symptoms of the patient, which is actually the most important point when having a patient in a situation of a follow-up. Meaning that the patient actually was operated on from lung cancer, and then after, the key challenge is to detect as early as possible the disease recurrence. And with Moovcare, we have a unique way to collect the symptoms and identify the situations where the patient needs to come to the hospital and have a CT scan because we have maybe a disease recurrence. And we know that treating recurrences as early as possible ensures the prolonged survival of the patient.
Absolutely.
Moovcare also allows to have a close follow-up of patients who are treated with advanced disease, and to prepare the visit of the patient at the hospital, because once the patient is coming, we already know what's going on, and we already know that the patient has specific symptoms, and we can work with the patient to discuss those symptoms and do what is needed to understand what's going on.
Excellent. I understand June 11th, I believe, in France, Moovcare was recognized as a digital health provider and granted the ability to get reimbursement from insurance companies. That's obviously a huge advantage for patients and for Moovcare. What challenges do you see facing the oncology practitioners and patients over the next several years? How can Moovcare help? What challenges do you see coming down the road?
So now we need to organize ourselves in the hospital, how we will integrate Moovcare in our patient pathways, in the medical records, who will manage the alerts, who will enroll the patient. So there is a lot of work to do. Still, this is the first time that a web application is reimbursed in the French healthcare system, so this is clearly a great news. We probably need now to work with authorities to have some reimbursement for the work at the hospital, the work that will be done by the multidisciplinary teams. So this is the next step. But still, today, having this availability of Moovcare in the routine practice setting is probably something that will completely change the way we follow the patient with lung cancer.
That's great news, obviously, for patients, the ability to have continuous monitoring, essentially once a week, to find out how they're doing, to catch things as early as possible. That's going to help people prolong their lives, of course. And to make things easier and faster for doctors is also a great news, because, of course, they can help more patients that way, and that's what everyone wants. Thank you so much for taking your time to come and join us on the show this morning. We certainly appreciate it.
Thank you.
My pleasure. And thanks to all of you for watching. If you like the show, please let us know. Like, share, and subscribe. If you have any questions for the doctor, feel free to leave them in the comment section down below. We'll make sure he gets those questions. Until next time, I'm Jeremy Ladner, and this is What's New.